I hope to see midwifery grow in a lot of different ways. I recently returned from a conference in Australia where I was able to realize how midwives can really run the labor floor. And maybe if we had more midwives on the floor and being able to support women in those ways, maybe birth would be a little bit better in our country. My name is Trinisha Williams, and I'm a midwife. Before becoming a midwife, I studied public health. I already had my bachelor's degree in science from a large university, and I had heard about midwifery and I decided to apply. My pathway into midwifery kind of, I guess, really began for me with my health science background. Since I knew I wanted to do something in medicine, I kind of did have a lot of those pre-science prerequisites. And my only thing is I didn't know what I was going to do with them. You know, my pathway to midwifery was also sharpened by seeing other midwives working as midwives and having that freedom to sort of support women however they needed to be, whether it was something as simple as, going the extra mile for a birth control refill, or even just trying to reassure them about who was going to care for their child when they have the next child. Um, I think midwives have big roles, and it's just figuring out how to support women and whatever they may need at that time. And I think my exposure to other midwives and seeing them doing it so sort of seamlessly made me decide I need to be a part of this. I studied midwifery at SUNY Downstate, and I learned a lot of things about how to care for women, not only in the antepartum and postpartum care, but also GYN and primary care. My midwifery class had a diversity of women coming from backgrounds of public health to nursing to being a dancer, just a variety of things, labor support doulas, just women that wanted to help support other women. We didn't have any males in our class, but there are male midwives out there. My clinical rotations were at North Central Bronx. There were a lot of great midwives there that had long tradition of providing care to women that, come from different cultures and different countries and wanting to, have their babies in a safe, loving environment. When I passed my ANCB exam in 2003, I began my career in midwifery at Kings County Hospital. I worked alongside a lot of certified nurse midwives, and a lot of them weren't even aware that I was a certified midwife. After a while, they didn't even recognize there being any differences other than our letters on the back of our ID. My favorite part of being a midwife, and also maybe one of my biggest challenges, is trying to help the medical community realize that birth is normal and natural, and that women only want us to help them to support them in that process. And that yes, there may be some differences on how they perceive birth to be, but it's our job to remind them of how their body is strong and how they can deliver their baby, and that they have the strength within them. The other big challenge is also for us to have more midwives. We need more people out there to be able to help support women.